Some more real-world applications of telehealth and uses. So I'm going to go ahead and pull our slide deck up. Make sure I share the sound because I do know there's a video today. There we go. All right, so now we're going to go through some of the more, practical applications of the use of telehealth. We've talked a little bit about, digital behavioral health and digital psychiatry or telepsychiatry per se throughout, but we're going to go through a little bit more in detail, and I will actually share a little bit of experience that I've had working in a previous job with telebehavioral health and some knowledge I have about our North Carolina statewide telepsychiatry program as well. So our objectives today are to be able to define telebehavioral health and its significance in expanding access to care, helping to assess potential barriers to telehealth adoption among diverse populations, and proposing strategies to improve accessibility and adoption. And then lastly, better discussing the future of telebehavioral health, some of those emerging trends, and then innovations in digital mental health. So as we look at the need, as you all are probably aware, many rural areas are what we would consider a health provider shortage area, or HPSA. Those are designated by HRSA, but there is an extra abundance of shortage for behavioral health providers in rural areas. There's a long wait, there's limited access, and then there's also that stigma that prevents individuals from seeking help. And then lastly, when we look at our insurance and what insurance covers, it's made a big improvement over the past years for what plans are willing to cover and not willing to cover. So we're seeing improvements in that direction, but there's still a lot of high costs for our traditional mental health services, especially when we think about, we think about the cost in dollars, but if we think about the cost in time as well, for individuals who are needing behavioral health therapy or counseling, those are often, maybe a weekly visit or multiple times a week to start if an individual's in mental health crisis, and just think about the time it would take to travel to and from those visits on a regular basis as well. So telebehavioral health is going to be the use of that two-way real-time interactive audio and video. So that's going to be a synchronous telehealth application. Again, using secure network with encryption, just like any other telehealth would be, making sure you're compliant with HIPAA, and then working to provide and support psychiatric mental health care. So that can be anything from patient to provider to in some of the telehealth platform applications that we have here in the state. It can also be emergency room physician having a consult with a psychiatric provider through a telehealth visit to determine whether, the patient that is in the emergency room for psychiatric concerns needs to, maybe move to an inpatient center, or if we need to look at an outpatient opportunity. Then also recognizing that there's a massive shortage of inpatient psychiatric beds statewide. And some patients do have to stay in, the emergency room before they're able to be transitioned into a inpatient unit because there's not enough beds. And so, what does that look like for the patient who can't be put into an inpatient system where they're waiting, and an emergency medicine doctor doesn't have all of the expertise on psychiatry that a psychiatric provider would. So it kind of jumps the gap and helps to bridge that conversation so that that patient who is in the emergency room waiting for their space to open up in another unit is able to still get that psychiatric expertise that they are very much needing. So as we look at Telehealth technologies, we're looking at our video conferencing, again, HIPAA compliant videos, calls, ensuring that secure communication. Mobile apps, there are some user-friendly mobile apps that can help improve access where you can actually chat with a mental health provider. There's one, some of them allow you to chat with a mental health provider. Some allow you to chat with kind of like a peer support specialist. The North Carolina Department of Health and Human Services recently partnered with a platform called Some Days, SOME Days, that is focused on teen mental health and peer support that they are trying to make available for adolescents statewide to be able to get some peer support on mental health services for anything that teens may be going through. And then there's the secure messaging to keep that information safe within those platforms. There's also at the state level and the federal level, the 988 crisis line for behavioral health services. And I don't have the number off the top of my head. I need to look it up. There's also a maternal mental health support text line where if you are, pregnant or postpartum, you are able to reach out to a provider who is very specialized in maternal and postpartum mental health concerns, so that if you need to talk to someone immediately, there's a text that you can have, or you can call a phone number. So there's another, just like a little bit of a telehealth component for crisis management there. I'm going to play this video.
Hi, Dr. Alexander. It's great to check in with you again. I've been practicing the strategies we discussed in my last appointment, and they seem to be helping. Thank you.
I started using an app to track my feelings and emotions, and I share this information with my therapist. It helps both of us understand my progress and identify the next steps in my treatment plan.
I wanted to know more about my daughter's recent diagnosis. Her therapist recommended educational videos that I could watch online. I found them very helpful in understanding my daughter's treatment plan and supporting her recovery journey.
These are just a few of the many ways that technology can be used to help in mental health education, care, and treatment. These new digital options for accessing health services, monitoring treatment, and finding information on health topics and healthcare all fall under the umbrella of telehealth. Technologies used in telehealth include apps for smartphones and tablets, video conferencing, educational videos and websites, and online patient portals. For men and women who find it difficult to travel to and from a doctor's office, telehealth may be an affordable, accessible alternative.
When we moved out to the country, I realized that it would take me more than an hour to drive to the nearest mental health professional. I went to my primary care doctor, and he was able to recommend a telehealth psychiatrist. Now, my psychiatrist and I use video chatting for some of our appointments or texting when I need more immediate care. I can even meet her in person when I need a face-to-face session.
Telehealth tools can also support in-person treatment.
I feel like my mental health app helps me work toward my treatment goals. It allows my therapist and me a better understanding of what triggers my symptoms and helps me keep track of my therapy homework.
People may find that telehealth tools help them feel less alone and more empowered when experiencing mental health issues.
My daughter's therapist was glad to hear that I felt more prepared as a caregiver after watching videos about my daughter's mental health issues and learning more about how to support her.
When deciding if online mental health care options might work in your treatment plan, you should also be aware of the potential drawbacks. There may be additional costs as well as privacy concerns when using telehealth services. Talk to your healthcare provider to learn more. Cost considerations for telehealth may include the cost of phones, computers, and high-speed internet. If you decide to move forward with telehealth services, such as treatment, team appointments, or sharing your health information, talk to your healthcare provider about the privacy of your information. Be sure there are data privacy protections in place, so that the healthcare information you share over the internet is not accessible to others. It is important for you to carefully weigh the benefits and drawbacks of telehealth services. Let's hear more from men and women who use telehealth services.
It has been a lifesaver to be able to talk to Dr. Alexander on my laptop when I feel my symptoms coming on, rather than having to miss time from work to drive over an hour to her office.
Using the app has made my recovery journey a part of my everyday life instead of something I only work on during my appointments.
The online videos have really helped me feel like an important part of my daughter's healthcare team and treatment journey.
The use of telehealth technologies in combination with traditional care is one way to bring you, your support network, and your treatment team together to support you and treat mental health needs.
Great. So as before we move on and in reflection on that video, I just wanted to give everyone an opportunity if you had anything that you wanted to add or any questions up to this point.
Well, I think it was really a good point to mention the travel time when going to any doctor, but especially mental health, right? And that can be very triggering for people. It can be emotionally draining, and to not have to get on the road after a really intense session, for instance, I think is just really valuable to just be able to be in your own home, be in a safe place, both mentally and physically. I think is really a huge benefit to not only patients but providers as well.
And in the job I had prior to coming to the Office of Rural Health, I worked in a rural behavioral health and suicide prevention network. I coordinated the network for farmers and agricultural workers and their families. And one thing we really talked about there was the time it would take to have a farmer who is in behavioral health crisis. Farmer suicide rates are astronomically high compared to their other counterparts. And so an individual who is needing support services, counseling, things of that nature to work through the stress of farming, but also how, their days often start at 6 a.m. and end when the sun goes down. And so the access to services is also very limited. And so we would talk about, a farmer's most comfortable on their farm in a location where they are used to being, and how, if the farmer drives their truck to the local behavioral health provider and they're parked outside, then they're worried about their peers seeing their car. They're worried about, local regulatory concerns about individuals that may see their vehicle at a psychiatric facility or at a counseling center and start to question, what's going on with them. There's some pesticide licenses and things that they're worried that they may lose access to, or they may be concerned about a loan officer seeing them, or even just their peers. Being able to have that teletherapy style appointment can be really beneficial for them to be willing to seek that care without having to be stressed and concerned about what stigma looks like for them. And we also talked about, that just further adds to the importance of internet connectivity in rural areas, because for a farmer may really want to use a telebehavioral health service, but without the internet and broadband connectivity, it limits their ability to do so, much like it would limit anyone within a rural community. But it's really interesting when you think about, the cost of time for the individual and the ways that we do have that access now that can help people to work through some of these things. But another thing to remember, as good as a telebehavioral health service is, it's really important that we also keep in mind individuals in behavioral health crisis or struggling with behavioral health needs do need to have a support, system surrounding them. And it's very important that, someone that they trust within their, family, friends of some nature is aware that they are getting those teleservices, just to make sure that they have the support. If there becomes a mental health crisis, there's an individual there that's like prepared to assist them, stay with them until emergency services can arrive, just because we know that when we're dealing with behavioral health concerns, the escalation to suicide is always something that could happen. And we want to make sure that though telehealth is very beneficial for providing this treatment, we want to make sure that there are boots on the ground individuals that are able to provide support and intervention to that individual should it be necessary. Pardon me. Any other thoughts on that one before we move on? Okay, so like I mentioned earlier, this is going to track through integration into primary care services for telepsychiatry. I mentioned a little bit about telepsychiatry through the emergency department, but looking from a primary care standpoint, we see a consultation approach where psychiatrists are able to provide expertise to primary care physicians. If you think about a rural primary care doctor who may be seeing a patient with a psychiatric or behavioral health concern, they know, the basics of beginning to recognize, understand, and diagnose conditions, but they don't have the expertise for the treatment or some of the nuance that a practicing psychiatrist would have. It's really important that that psychiatrist is able to provide that consultation to the provider in a rural area. Having a integrated health team within a clinic that allows for integrated care from start to finish helps to get that comprehensive treatment plan for better outcomes. Now, if you think about what you would typically go see a primary care doctor for, maybe you have high blood pressure, but you're also an individual that is diagnosed with generalized anxiety. Now, if you have high blood pressure and an anxiety disorder, anxiety is known to also increase blood pressure. And so it's really important that the physician and your care team are able to look at those things side by side, which is where that consultation can come into play again for the psychiatrist to provide the input on the anxiety disorder, and then the primary care doctor can provide the expertise on the other chronic condition that they're trying to manage in tandem. So we're seeing now about 30% of primary care practices are offering integrated telepsychiatry services. This is slowly becoming kind of a gold standard. So we are going to, hopefully continue to see an increase in the number of integrated services that are being offered, especially in rural health in particular. So if we look at some real life case studies, with integrated telepsychiatry services within primary care, we're seeing from a VA study, there was a significant decrease in these psychiatric hospitalizations after the implementation of telepsychiatry, looking at hospitalizations for psychiatric reasons being reduced by 25%. We've also, with telepsychiatry services and telebehavioral health, seen access in rural areas to telehealth or telebehavioral health services increase by 40%. Both of these came out of the Rural Health Information Hub on rural behavioral health. But as we look at some challenges and future directions, there's that regulatory hurdle is always going to be one of those things that we've really got to work around and navigate. Cross-state licensure, when we look at telehealth providers, there is a likelihood that if you're using kind of a large platform model, there's going to be individuals who are living in one state trying to see patients in another, and they have to have multiple licensures. We also have to be aware of what do prescribing regulations for medicines, especially psychiatric medicines, require for the individuals who are using that telehealth, because what can be done and is allowable in one state for a psychiatric controlled substance may vary across state lines. So what does that look like for individuals? And then, like I mentioned previously, those telehealth waivers that are expiring at the federal level and the waiting for, what is going to be available? What is that regulatory hurdle going to be should things shift? We see some technological advancements. There are some artificial intelligence assisted diagnosis and some virtual reality things that are, therapeutic, that are showing promising results in trials. I have not read of anywhere where this is happening in true healthcare practice, but there are some of these advancements that are coming forward. I know you can Google, depression screening tool from your phone, and you can probably come across the, PHQ-2 and the PHQ-9, which are the diagnostic tools for depression. But you also, there's a lot of different, websites and apps and things of that nature that say that they can help you to, diagnose or better understand depression, but recognizing, is that trusted? Or is it better that you find an in-person provider who can do those screenings with you so that you have the support of a healthcare practitioner on the other end? And then recognizing that telehealth as a whole is still very new. Healthcare is ever changing. Psychiatric conditions are ever changing. We live in a time where diagnosed mental health conditions are, high compared to previous years. And we, are still trying to understand what and why and what is contributing to that. But there hasn't been a long-term study on how efficient and how, what the quality is of telebehavioral health services and long-term treatment, as well as what does the cost effectiveness look like. We could assume that it probably is saving money and increasing the efficacy of treatment, but there is not a lot of data out there yet. So we're, operating in this, we think this is what we're going to see as an outcome, but we aren't 100% certain at this time. So those are things to be aware of. And as we look at North Carolina, where you look at the different telebehavioral health platforms, we look at, the expansion of services. If we think about our North Carolina statewide telepsychiatry program, or what they call NC STEP, it's ever expanding. It started in a emergency department consult service, but is now transitioning into being a more integrated health model where they're working with community centers as well as primary care providers to offer those consults. We see new technologies that are constantly developing that will likely enhance our telehealth to improve care delivery. There's an anticipation that that artificial intelligence integration may be helpful. Again, trying to work through what does that look like from a privacy and security manner. There's a lot of really smart people on that would know way more about it than I probably ever could dream of. But seeing how, on the forefront of some of this new technologies, how that could impact our behavioral health, telehealth within our state and nationally. And then we look at partnerships. So we're talking about these collaborations, we're talking about these consult services. But looking at how do we collaborate best to improve our reach of behavioral telehealth statewide, making sure that we are serving that population in North Carolina to be able to enhance the quality of care and increasing the access to behavioral health care statewide. But also, if we want to serve, the entire population in North Carolina, we also need to look at, how can we use behavioral telehealth to better address and lessen the stigma that a lot of individuals seeking mental health services are, facing too, because that's one of the first barriers. There's the barrier of access in a rural community, but then there's the barrier of stigma within a rural community. And, how do we use a lot of these technologies to educate around behavioral health needs and make it a little bit more, accepted and less stigmatized within our rural communities also. So as we look at our our future of what we're thinking in psychiatric care, our future of what we're thinking in our consult-driven telehealth services, we're looking at, telepsychiatry as a complementary approach to that traditional care model, that powerful solution to those providers' shortages and access barriers. So we're seeing, starting with our enhanced access, like we mentioned, reaching those underserved populations. Then we're looking at combining in-person and virtual care. So any number of ways, if you have an in-person primary care visit and you need a consult with a psychiatrist, or maybe you are seeing a psychiatrist for the maintenance of the medication necessary for behavioral health treatment, but you're also seeing a therapist, and maybe you can see the therapist virtually. And then I believe the regulation is still every 3 months or every 90 days for psychiatric medications, you're required to be seen in person so that they can check vitals and things of that nature. You're using that hybrid model. And then we are looking at some of our technology integration, some of these advanced diagnostic tools, advanced treatment tools that can be applied in our psychiatric care and behavioral health care. And then lastly, we really have to look at our policy development as telebehavioral health treatment moves in the direction of becoming more normalized. We need to look at what are the supportive regulations that are necessary. How can we best write policy and shape policy that allows for the treatment and use of telebehavioral health while still ensuring the, proper privacy, quality, what's out there that allows supports for individuals that maybe are in crisis and have a telehealth appointment, recognizing that, we advocate that people have a safe, quiet, private space in a telehealth setting. But what does that mean for an individual in behavioral health crisis? What are the steps necessary? What is an action plan for an individual who maybe is exhibiting signs of crisis and is, in a telehealth setting in person? There's trained professionals there with action plans who are able to act immediately and have that individual, immediately in the company of someone else. But in a telehealth situation, that's really limited. So there's a lot of things to think through when you start to think about implementing some telebehavioral health practices, even in a primary care setting, in a clinical setting, that there's a lot of risk associated with treating certain things and recognizing that you need to have checks and balances in place to make sure that you're able to keep your provider safe and you're able to keep the patient safe as well. And so before we move into our knowledge check for today, I'm going to stop sharing my screen so that you all, if you have any questions or thoughts, can come off mute, share, put things in the chat so I can see them. Like I mentioned before, I did work with some telepsychiatry and telebehavioral health services in a previous job. So I, will do my best to answer any questions that you all may have. If I'm unable to answer, I have a contact of someone I can reach out to hopefully be able to get you all some answers and get back in touch with you as well. And if we don't have any questions, I will go ahead and put the knowledge check link in the chat. The link is in the chat for you all. Let me know if you have any difficulties with it.
No, it works. Thank you, Courtney.
You're welcome. And as you all finish, you're welcome to just drop off like usual. And like I mentioned earlier, I'm going to cancel the meeting sessions that were sent out by me, and Mira will be sending new ones out in follow-up. I'll probably do that cancellation later this afternoon after that noon session so that everyone has chance to be aware of what's happening.
I was gonna ask, is last week's